Hey guys, my name is Dr. Yazdan. I'm a cosmetic dentist in Newport Beach, California. Welcome to my channel. So today I have a full day, and one of the things I do in my office when I'm working on front teeth is a process called custom shading, where I have my lab technician come in and we work on the patient's teeth while they're physically in their mouth, and then it's a whole process. We have to bake it in an oven that goes up to 1600 degrees, and that takes a while, and we have to let the restorations cool. And the reason we do this is whenever you're working on front teeth, the gal I'm working on today, she has one root canal tooth in front and then an implant crown. Whenever you're doing cases in the front, even if they're super straightforward, it's probably one of the most difficult things I do in my career is to make one or two front teeth look like all the rest of the natural teeth. And the reason that's so difficult is because natural teeth have so many different shades to them. They have so many different colors. And when we take photos and videos and send them to our lab technicians or have the labs look at them and take notes, and then they make the restorations that way, no matter how good of photos you take or how well of notes you take or they take, when they make the restorations, it doesn't always translate to the tooth just as the way that we want. And it can get really, really close, but sometimes it takes that 20% of human touch that makes all the difference. And when it comes to the work that I do, the difference really is in the details. So I have my lab technician coming in today. We're gonna work on this case and make sure that any refinements we need to do can be done in the office. It's a really awesome process. So stay tuned. I'm gonna take you behind the scenes and show you a little bit about what we do and when we custom shade our patients. Also, I want you to know, if you like this video, make sure to subscribe, and also make sure to follow me on Instagram. I'm at Dr. Yazdan. I always am showing behind the scenes and all the cool things I'm doing in my business and my personal life. So I'd love to see you there as well. All right, stay tuned. We're gonna get to it. So my lab tech is working on those. We just tried them in on the patient, and they need some work. It's a really difficult case whenever you have one front tooth and an implant crown next to each other, especially if the front tooth is root canal. There's not much tooth structure. It's super difficult. So we're gonna be working on that most of the day today. And at the same time as I'm working on that, my lab tech is working on that, I'm gonna be working on doing a case where we're doing it's either 8 or 10 veneers, I can't remember, but basically we're gonna change this patient's smile and make it really beautiful. I'm gonna show you some behind the scenes of this custom finishing case that we're doing though. And if I can, I'll get some footage of the patient that I'm gonna be doing the veneers on. So I just finished my day. The case with the 8 veneers went very well, super smooth. The other case that we were working on, the custom shading case, so basically we got it almost right, but I needed to send it back to the lab. My lab tech wasn't able to make all the refinements I needed done here, so we sent it back to lab, made new temporaries for the patient. We're almost there. So she's gonna be seen in about a week or so again with our lab tech, and we're gonna finish her case. And at some point, you're gonna see the finished product, and I would love for you guys to head on over to Instagram, because that's where I post most of my before and afters. But you got to see some behind the scenes, and the custom finishing part is so special. It's really nice because as much as like photos and everything that you send, nothing really replaces an actual human that's physically looking at the teeth inside of the patient's mouth. So when we send photos and we make models, they make the teeth off the models, here comes Sandy. She's always interrupting when I make
the show.
I love it. When we have patients that, you know, we send their lab work to be done at a lab or whatever, like they see photos and videos and everything of the patient, but they're not physically there looking at the patient. So this is what makes it really unique, to have someone physically actually here looking at the patient, working on the teeth while they're in the patient's mouth, and like baking them in the back in our oven and then working on them again inside the patient's mouth and just refining it. Makes all the difference in the world. And when we do that, those 1 or 2 front teeth look so incredible. And a lot of times patients will be like, I don't even know like which one was done. They blend in so well. So that's why I do it. It does take a longer time. Like you can see, the patient's gonna have to come back, and that's not always the case. Sometimes it's like patient comes in, we get it done. we put the teeth in, but sometimes it is a little bit of a process, but the point is to make sure that the patient is super happy with the restorations and that I'm super happy with the restorations so I can sleep at night knowing I did my best work possible. So that is it for today. I am off to see my daughter, give her a bath, put her to bed, and then I actually have a coaching client tonight. So if you like this video, don't forget to like and comment below. Ask me your questions. I'm happy to answer. If you've never seen this process before of custom shading or custom finishing, let me know if you have questions about it. I would love to answer. And don't forget to subscribe to the channel and hit the bell. And I will see you in the next video.